What is going on, everybody? Today, I know I haven't been doing the daily videos. I've been super busy with a lot of different things, including stuff for the websites and some of the social media channels. But I want to jump on today because I got a few questions regarding trauma assessment, questions about trauma when it comes to the National Registry. But this content really can help you, not just with the National Registry exam. I always say that the stuff I put out there is not just to help you pass one test, right? It's to help you pass any test, it's to help you do better assessments, to interact with other healthcare professionals, to write your documentation, all that good stuff. All right. So I want to talk a little bit today about National Registry and some of the questions you might see, but I also want to talk about how you can sort of apply this stuff. All right. So if you like this stuff, guys, you want to get more information, be sure, hit that like button. Let me know that you are getting some value out of this. And that you can actually, a lot of stuff to talk about today is part of the EMS Quick Study Guide. And I actually have a free offer where you can actually get that physical guide for free. If you take me up on that offer, you can go to freeemsbook.com and get more details on that. But wait until after this video, because I want you to watch this video first, and then you can go check that video out later. So again, we talk about exams, we talk about things that we are trying to study and to memorize and things like that. But really, guys, we have to be able to apply what it is that we are learning. Okay, we have to get these concepts, we have to study them, and it's not just memorizing things, taking exams and memorizing questions, memorizing answers. You've got to really be able to understand the concept. So what I want to do today is talk about some of the major concepts, and hopefully you can go ahead and maybe focus on these if you are not, because this is the type of stuff that you will see questions on your exams. And by knowing these key concepts and what they're involved in and what all revolves around them, when you see questions, you'll be able to put it together. It's not going to be just trying to memorize a specific question and specific answers, right? You'll know things because you know the entire concept. For instance, knowing how to assess a patient, identify shock, and developing shock, right? Guys, I'm telling you, this is a key thing that you need to know, because you will get various questions on a test that revolve around shock and how to identify shock, how to assess a patient with shock. And along with that, we're talking trauma now, is being able to tell the difference between minor bleeding, moderate bleeding, or extenuating hemorrhaging, right? Where the patient's bleeding out. All right. Another key thing you will see questions on. And think about it. You've got to know that whole concept, because when you're looking at a scenario, the scenario is not going to say the patient has minor bleeding or the patient has major bleeding. It's going to give you clues. So when you know how to differentiate the different types of bleeding, that's going to help you with the exam question. Okay. Now, you're also going to know how to control that bleeding, how to control external bleeding. What would be the appropriate method, let's say, for a moderate or minor bleed versus somebody who's bleeding out, right? What's the appropriate method? What's the appropriate equipment for that? Recognizing signs of internal bleeding. And we're talking about trauma, right? What are the signs of that internal bleeding you might see for trauma patients? All right. Again, guys, these are key concepts, very broad, right? What I'm talking about here. But when you know the concept and you see scenarios, you can pick out the clues in the scenario, pick out the clues in the question, and compare it to your answer choices. And it's going to help you come to the correct answer much, much easier. Okay. Guys, you're going to want to know how to treat soft tissue injuries. Basic stuff, right? But it also includes things like avulsions and amputations. How are you going to treat that? All right. Knowing how to assess or manage open and closed chest injuries, open and closed abdominal injuries. Okay. And again, guys, this is basic stuff. And I hope that this is clicking for you a little bit. If it is, do me a favor, hit that like button, hit the little squeezy heart button or whatever. Let me know that it's making some sense to you, right? Because I know I'm kind of listing off a key concept for you, right? Control external bleeding. Okay. I'm not going to give you a big lecture here in a quick YouTube video. I'm going to keep these down to like 10 minutes, right? But I'm hoping that you're going to say, okay, I need to know that concept, because that concept, if I know how to do that, if I know how to recognize internal bleeding, if I know how to treat and control external bleeding, and I see it in a scenario, if I see it in a question or an answer, okay, it's going to make sense to you. All right. Now, what about things like managing head injuries? How to assess for head injuries? What about assessing a patient with a spinal injury? Now, these days, we're not doing the whole everybody gets a longboard type thing anymore, right? But you also have to know how to decide and how to put into action an appropriate spinal motion restriction, okay, when necessary. And you're going to want to identify things like burns. All right. Again, another trauma thing, right? Knowing how to see if it's a critical burn versus a non-critical burn, knowing how to use the rule of nines. Okay. You're going to want to know how to manage those patients, manage those burn patients as well, right? You're going to want to know how to do that. All right, guys, all this stuff is the type of things that you need to know. And again, while this is maybe basic, you might say, oh, I know the rule of nines, Jim. I know what it is, 18%, 9%. Okay, right, I know all that stuff. Okay, but guess what? The key that I'm trying to put across to you here is that while you can memorize certain things, right, control external bleeding, direct pressure, elevate the extremity, all that type of stuff, you also want to know the background of that, all right? Because the questions you're going to see on exams, not just national registry exams, but you're going to see questions, you're going to get scenario-based questions where they're trying to, what I think, dance around the bush, right? To kind of weave in and out to make sure that you are thinking critically on what is best for that patient. So things like I mentioned earlier, as far as identifying shock, developing and developing shock, how to differentiate between moderate bleeding, minor bleeding, and major extenuating bleeding when they're bleeding out. Those are major things that you're not going to see it's spelled out for you in the question, but when you know how to identify it, you know the little ins and outs there, that is going to help you identify what the question is actually asking you. Okay, guys, I'm going to just wrap this up today. Just a few more little things that you need to really kind of grasp and focus on. If you're not already doing it, or you don't have a full understanding of it, is how to assess, how to manage injuries to the bones, musculoskeletal injuries. Okay, knowing how to do that. Okay, and also how to identify, manage, assess people that are having environmental things, extreme heat, extreme cold. Okay, this is all going to fall under trauma type stuff when we're thinking about the exam, right? So while some of this might kind of cross over, like the environmentals might cross over a little bit to other areas, head injuries might cross over a little bit to other areas. Primarily, guys, we're talking about this when it relates to trauma, okay? So, guys, I hope this makes some sense. I'm going to end it there, because what I want you to do is think about some of the things that I mentioned today, because if it's making sense to you, all right, then maybe you don't need to go ahead and crack open that textbook. Maybe you know it all. You're not going to have to go ahead and go deeper into these concepts. But if you're in school right now, or you're recertifying, or you're reviewing, or maybe you have a job interview coming up, you've got to take a test where you've got to kind of refresh your memory on this stuff. Guys, if you don't know all about these concepts and you're not exam ready, okay, you're not ready for that, open up your textbook, guys. Review those key concepts. I'm telling you that an effort to go ahead and do that, while it might seem like you know it all, you've read it all, okay, we've all done it. We've all read about Rule 9 a million times if you've been in EMS for any length of time. But going back to review it, locking in that information again and refreshing your mind about it a little bit again is going to help you when it comes to when you're taking that exam. Okay, so open up that textbook, review on these key elements, guys, and be better at EMS, because it's going to help you with your actual patient care, right? But it's going to help you get through that exam as well. And like I said, guys, if you want even more things to help you review and understand, go to freeemsbook.com. I have a free copy of the EMS Quick Study Guide that I want to send you if you take me up on a special offer I have there that's even more in depth on how to get you prepared for exams and to be better at EMS. So, guys, I'm going to end it there. I hope you got some value. Please, please, please hit that like button. Let me know you're getting some value out of this, that this kind of made some sense to you, that some of the things maybe didn't ring 100% in your head and you understood it, and you're going to go ahead and open that textbook. Whether you take me up on my offer, whether you watch more videos of mine or somebody else's, be better at EMS, okay? Do the right thing and be sure that you know what it is you're doing for your patients and why you're doing things for your patients. All right, that's it, guys. As always, I'm Jim Hoffman from EMSSEO.com. Stay safe.